Dear colleague, welcome. It's Dr. Jack, and I'm here to talk about a difficult topic with you today. What do you do if you fail your exam? Well, first thing is take some time. Take some time to come to terms. When you first open up that envelope and you see that you failed the exam, it'll hit you like a ton of bricks. You don't need to do anything. You do not need to start studying. Just take it easy. Sleep on it. Give yourself a few days, a week or two. You don't need to start studying. Your next exam is half year or a year away. And, after a while you will see that no one will love you any less because you failed the exam. Or failing the exam will not materially hurt your career. It doesn't seem that way in the short term. But after you have a few days of perspective, I think then you will be ready to move forward. The second thing is, do not beat up on yourself. It's sometimes easy to just want to be angry at oneself. But if you are beating up on yourself, that means you are getting beaten up. And you can't afford to be beaten up because you are your only resource. You have to do well. You have to be in good shape in order to go forward to conquer this exam. Then when you're ready, do assess what went wrong and where you can make changes. For example, if you ran out of time, that's not very common, but if you did run out of time, that means going forward in your studies for the next exam, take a lot of practice tests and time your pacing. Most exams have about a minute per question. If you're off that pace, then you could practice speeding up. Notice what type of questions really slow you down. There are a lot of questions on exams, all kinds of exams, where the answers, you're not certain about them. Certain individuals have a hard time with that uncertainty, and they almost freeze up. Pay attention to that. You're going to have to, in a way, desensitize to that feeling because the time is clicking and you need to kind of move on. And you're just going to have to take your best guess and move on. And also, as you're taking your practice tests, you can practice to speed things up if you need to. If you didn't do well, but you took a very short amount of time, well, maybe you would do better if you actually slowed it down. Maybe you're rushing through reading the question and you never fully understand what you're being asked. Next, do go ahead and review your exam performance report. So I want to give you a tip that may seem counterintuitive. So on every exam, there are a certain number of topics, maybe 4, 6, 7 at the most, that are very large topics. Close to 10%, sometimes over 10% of the exam just on that one topic. For example, in internal medicine, cardiovascular disease is 14% of the entire exam. ID, gastroenterology, pulmonology are also large topics. In psychiatry, the big topics are psychotic disorders, mood disorders, substance use disorders, neurocognitive disorders, and so forth. In neurology, it's going to be vascular disease, epilepsy, neuromuscular diseases, among others. So even if you passed that big section, there are still a large number of questions that you got wrong. Just because the percentage is so high, the total number of questions in that section is so high that even if you pass, the number of wrong questions is still substantial. Now, in addition, on every exam, there are going to be a dozen or maybe 24 topics that have very few questions associated with them. For example, on psychiatry, sleep disorders, it's 2% of the exam. There might be 3, 4, maybe 5 questions at most. But sleep disorders, there are many of them, and they're pretty complicated. And it could take a long time to really master that area that really has very few questions associated with it. It makes more sense to focus on the big topic areas even if you pass them. If you did not pass them, then that's a no-brainer. That's really where you need to spend the time. Now, there's one last thing I wanted to talk with you about, and I want to say this gently. So, yeah, I don't want you to throw like rotten tomatoes at my head. I don't want to upset you, but this is what I want to say. Sometimes there is a silver lining to failing an exam. And as physicians, we are all high performers. We've all worked hard, spent hours and hours, years, decades studying. And some of us don't really have a history of failing much of anything. And then when we fail something like a board exam, it's really, we can take it hard, really, really hard. It may really undermine our self-concept, our sense of ourselves and who we are. Now that sounds pretty negative, but there is a silver lining there, because we are more than passing or failing an exam. Maybe it's time to really rethink about what makes us who we are. And if we've never failed, then maybe we're not taking enough risks in our life. You know, failure has to be part of the things that we do. If we're always passing everything, succeeding on everything, maybe we are playing it just a little bit too safe. In my own case, in my psychiatry, at the time, I'm a psychiatrist, at the time we had written boards and oral boards. And I took and failed my psychiatry oral boards twice. I choked. And lo and behold, it turned out to be one of the best experiences in my life. Not at the time, it felt horrible. But it led me to really understand what I was doing wrong. I was a junior faculty member at my university, and I started training my residents about how to better interview patients and present cases. And then that led me through a series of steps of starting the American Physician Institute, which is now my full-time job. So it was my failure that ironically led to my greatest success. And if it wasn't for my failure, I wouldn't be talking to you right now in this capacity. Again, I don't want to stress this too much. You may not be ready to hear this, but I do think it is an important part of the message to share with you. In any case, if there's anything I can do to help, certainly reach out to me through Dr. Jack, D-R-J-C-K, at AmericanPhysician.com. Take care of yourself. Signing off, it's Dr. Jack. Thank you.